Hey guys, so people that present to the clinic with groin pain or pain in the front of their hip, they oftentimes have a problem within their hip joint itself. This is true hip pain, and it's usually emanating from the ball and socket joint. The ball and socket is a joint that's from the femur bone and the socket itself, which is part of the pelvis. Different pathologies that can cause pain in that area generally are osteoarthritis, which is degeneration of the joint, and you can also have labrum injuries, which is a labrum is a gasket of tissue that goes around the socket that acts as a suction seal between the ball and socket. When this is injured, it can create pain. Another thing we're commonly seeing nowadays is something called hip impingement. Hip impingement is where the ball and socket collide against each other. It's a motion, and this can also pinch and damage the labrum and damage the cartilage of the hip joint. All these conditions, generally speaking, create pain in the deep groin area. Patients will oftentimes use a C sign to describe exactly where the pain is coming from. It can radiate down the front of their hip. This is often associated with physical activities and athletics, and it's generally treated with a conservative treatment program at first, which consists of 6 to 12 weeks of physical therapy. We often combine this with sometimes anti-inflammatories, heat, ice, and other modalities that help with pain. And generally speaking, nowadays for hip impingement and labral pathology, we're able to go in with minimally invasive small incisions with a camera into the joint, and we're able to correct abnormalities that are causing the pain.